from there to an issue which our politicians should be focusing on also, Omicron. Doctors, nurses and health workers are now hard hit as the Omicron wave takes more and more cases. Over 1,000 doctors across India have tested positive in the last few days. What will it do to India's healthcare system? That's our other big focus today.
Omicron may be causing low levels of hospitalizations, but it's still hurting. The new coronavirus variant is infecting high number of doctors and health workers, threatening to hit hospital services. Over the past few days, over 300 healthcare workers and doctors from Delhi, including 90 from the government-run Ram Manohar Lohia Hospital, over 50 from AIIMS and Safdarjung, and 13 from the Gangaram Hospital, a private facility, have tested positive.
Doctors, nurses, they are also the part of the society, and we have seen that over the last 3-4 days, we found that our 7 staff, 2-3 nurses and 2-3 doctors, 1 Safai Karmchari. So total 7 so far in the last 3 days. They got the positive, and we are sending the sample for gene sequencing, whether we are dealing with the Omicron or whether we have the Delta.
At a time when the COVID-19 cases are surging in the national capital, there are reports of at least 100 healthcare staff testing positive of the COVID-19 in the national capital. Government hospitals including RML, LNJP and Bara Hindu Rao has witnessed a surge of healthcare workers including doctors testing positive of COVID-19 in the past week. Now this trend could throw a challenge at the medical healthcare infrastructure of the government hospitals, which is already under stress due to the delay in the NIT PG 2021 counselling.
The crisis is not limited to Delhi. 157 doctors at Mumbai's King Edward Memorial Hospital tested positive over the past 4 days. 61 have tested positive at 4 hospitals operated by the JJ Group, and another 30 tested positive at Sion Hospital. More than 100 doctors and paramedical staff have tested corona positive at PGI Chandigarh in the past 48 hours.
The number has increased many folds, and maybe around 100 of doctors plus medical staff, paramedical staff, they have got infected. But in most of the cases, with the doctor and this medical staff and also in the general public who are getting infected, 97-98% are the asymptomatic cases, and they do not require any medical, any hospitalization.
In West Bengal, over 400 doctors and medical staff from various medical hospitals have tested positive. The Union Health Minister put on a PPE kit to visit infected healthcare workers personally at AIIMS on Thursday. The silver lining, though, could be that patients in the third wave, including doctors, seem to be recovering quicker, particularly if they are vaccinated.
At the moment, we have hardly 8 or 10 people who have been tested positive. But the good part is they have already completed their isolation period of 7 days. So 3-4 of them even joined back. And it was a very, very mild asymptomatic disease. And but yes, as a protocol, we asked them to get themselves isolated for the benefit of the other people.
The rate of infections among health workers is a reminder for all. While Omicron may cause mild symptoms, it could still overwhelm India's hospital infrastructure. With Amit Bharadwaj in New Delhi and Indrajit Kundu in Kolkata, Bureau Report, India Today.
Let me now go to the country's top virologist, one of the country's top virologists, Dr. Gagandeep Kang, joining me. Dr. Kang, appreciate your joining us. The fears that one has is Omicron growing exponentially, 20,000 caseload for the first time in Mumbai in a day, 6-fold rise in just a week. How bad can it get in terms of total caseload, and could it go out of control? Or do you believe that because the symptoms are mild, hospitalizations and illnesses are low, we should look not at the positivity rate and case numbers, but at hospitalizations and illness?
I think we need to be looking at the totality of evidence. So case numbers do matter. Test positivity rate does matter, because a test positivity rate pretty much tells you when you're going to run out of tests. And you won't have then a handle on how many cases are really out there. Once you're beyond 30-40% positivity, The test positivity rate is a limitation of, it just shows you that your testing is now very, very limited. You're not capturing all cases. For the healthcare system, what really matters is the hospitalizations. And again, accurate cases can give you some prediction of the hospitalizations that are to come, because hospitalization is a lagging indicator. And the lagging indicator that comes after hospitalizations is, of course, deaths. So we need to look at all aspects of the data that needs to be generated to get an idea of what's going to happen. Are we going to see more cases?
Right.
Yes, in huge numbers.
Right.
The numbers are really going to go up, and the only limitation on those numbers is going to be the testing. Now, in terms of predicting how high it's going to go, I don't think we can predict that now. We can talk about potential scenarios. What would be the best case scenario? What would be our worst case scenario? And you don't want to go to worst case.
No, I want to go into both best case and worst case. Give me the worst case and the best case scenario as things stand on Omicron.
The worst case scenario is that our vaccines and prior infection do not protect as we hope they will. Because remember that again, no other country has the mix of vaccines and the prior exposures that India has. So what we may face might be different from what we've seen in other parts of the world. So you might see a lot of cases, and that might result in a lot of hospitalizations and deaths. I don't think that the likelihood of this scenario is very, very high. I'm hopeful that we'll be erring more towards a middle of the road scenario.
You're saying middle of the road scenario. Am I to understand? Because at the moment, what are we seeing, particularly in cities like Mumbai and Delhi? Low level of hospitalization, but a very high caseload. Is that something that's going to persist over the next month? Or is it just possible that Omicron causes mild symptoms, home remedies are enough, and we can overcome it in, let's say, a 6-week period? Cases rise very quickly in the next 2 weeks, but then fall very quickly as they did in South Africa. Is that what you're likely to see in this country?
That's your best case scenario. That we will have a reasonable degree of protection, that the virus will be mild, that we'll have lots of cases, very few hospitalizations, and very few deaths. But I think one thing that we need to remember is that there continue to be vulnerable people in our population, either because they are unvaccinated or because they have comorbidities and have not maintained. And because these are particularly vulnerable people, these are the people for whom we need to be preparing to protect them from getting infected and getting severely ill. For the general population, I think we will do all right. Based on the data that's coming from around the world, we will see a lot of cases, but I think in general, healthy people will get no symptoms or mild or moderate symptoms and be able to weather this very well. My worry really is about the same group of people that we dealt with previously, the ones that had severe disease and died, which was largely people with comorbidities and the elderly. Now, if they've been unvaccinated, they are vulnerable. If they were vaccinated a long time ago and have not been infected, they may also be vulnerable.
So what you're saying to me, healthy people not to worry, those with comorbidities and senior citizens remain the worry. In terms of the road ahead then, in contrast to what happened with the second wave when there were those large number of deaths in a short period, do you see therefore the third wave very different? We are more vaccinated now than we were in April, May. Will it be very, very different this time? And therefore no need to panic at least.
So I think we should now think about the third, fourth, and fifth waves. What is our path forward every time a new variant comes around? because there will be more variants. The important thing to remember is that in general, healthy people, young people are not at great risk. Children are not at great risk from any of the variants that we have seen. We have not seen high levels of severe disease or mortality in any of these groups. These groups need to get on with their lives. Take precautions, but continue with your lives. Where we talk about vulnerable people, now comes the situation of how do you protect the vulnerable best? Best we know is vaccines. Do we need a booster or a precautionary dose? We know from the rest of the world that you get an incremental increase in the amount of protection that a third dose can give you. I know the numbers sound phenomenal when you read the papers from the West, but it is really an increase on top of the bulk of the protection that is provided by the first two doses. So we need to decide where our risk-taking behavior is going to lead us to. We have to remember that Omicron is one variant in a long line of variants. There will be more. And for how long are we going to continue to focus only on SARS-CoV-2 and ignore the rest of the healthcare system?
Let me ask you though, in conclusion, at the end of our last interview in December 2021, you were much more hopeful of having a better 2022, and then along comes Omicron. Are we going to see a better year in 2022, given the fact that you're saying there will be more waves, more variants? Or are you simply saying we cannot lower our guard, the virus is still out there, we just don't know what tomorrow brings?
I think the time to lower our guard will be once we get through this wave. I think viruses and infectious diseases, the time has come to start thinking about them like the weather. When there's a cyclone coming, you prepare for it and then you get on with life after that. But you build preparedness for future cyclones. So that's the way to think about it. When it's going to rain, carry an umbrella.
Well, I'm certainly, if not carrying my umbrella, Dr. Kang, certainly carrying my mask straight after this show, back to the mask. The studio is empty. But thank you very much, ma'am, as always, for joining us and putting in perspective what's happening around us.